start. We're going to start off with a special program today because, as we've said before, one of the reasons that one of what Thrive's jobs is to really help you guys amplify your message. Mm-hmm. And so we already did some work on social media, and this time we wanted to talk about traditional media. So we have a fantastic panel here to talk about the different kinds of more traditional media that we have, as well as social media, because at this point, as you know, there's a lot of overlap between how that works. So we wanted to give you an opportunity to meet these fantastic panelists and to have a discussion about how this relates to your work. How can we work together to get out the messages? And right now the message is about COVID, but there will be other messages that you might want to get out. So this is a great way to familiarize yourself a little bit with some of the local media, as well as some of the techniques that the local media would like to see you guys be more familiar with. So with that, I want to let you know what the agenda for the day is, which is basically we will be have the media panel for the first half hour. And then after that, we have Dr. Curtis Chan will be here to answer any specific questions related to the health department or anything that he can, a more technical side that he can answer for us. And after that, we're going to be doing some breakout rooms. This time, we're only going to have 3 breakout rooms. We're going to be doing one Latinx, one AAPI, and then one for everybody who doesn't fall into those 2 categories. And we're going to really focus at that point on what we learned from our media panel, and also just whatever specific issues you guys are encountering right now. Then we'll come back, do a quick breakout, and all of that we're going to accomplish in a very short 90 minutes. So with that, I want to first introduce Henrietta Burroughs, who has been a fantastic partner for Thrive, for bringing this panel together, for the EPA Media Center is her organization, and she's going to tell us a little bit about what she does there so that you can know the full extent of how deeply ingrained Henrietta is in the community, both in East Palo Alto, where she works, but also across media. When I reached out first to Henrietta and I said I had this idea and maybe she could be the facilitator, since I know that she is very familiar with all of this and very familiar with the work, of course, that we're doing, since she's one of the organizations that's funded here. And she not only jumped at the idea, but also had lots of ideas of people to reach out to. So I really appreciate her partnership for all of that. So before I turn it over to Henrietta, we're going to do a quick poll because it's always fun to hear from you guys what's going on. So Kirsten's going to put up the poll. In the meantime, I want to let you know that, first of all, you can answer as many as you want. So go ahead and click through that, because this will be really interesting to see. The other thing is we want this to be a conversation. So please go ahead and type any comments in chat, but also questions, whatever you want, just keep the conversation going there as well. So we'll wait till the poll is over. Everybody has an opportunity. Sometimes you have to check a lot of those. So this is actually just for you. Like, where do you get your news? Not a lot of people have physical newspapers anymore, and it's interesting how few people are getting it from TV. And it's interesting how old our audience is. You can see by how low the numbers are on TikTok. So, terrific. Okay, Henrietta, do you want to go ahead?
Sure, thanks so much, Petra. Well, as the moderator of this particular forum, I came equipped to introduce everybody else, not myself. So saying something about what I do is something of a surprise, and I'll make it quite short. I started the East Palo Alto Center for Community Media in 2003 to create media outlets in East Palo Alto, since the city didn't have one. And in 2006, launched the city's first newspaper, East Palo Alto Today, the first newspaper that the city had had in 20 years. And during that time also, I started talking with Henrietta, an hour-long TV show, to discuss the issues of the day with community newsmakers, local newsmakers, state newsmakers. So the East Palo Alto Center for Community Media has been a blend of print, online, and also television. And with that being said, I'd like to begin by talking about what we'll do today, which we'll discuss regular media. Many of you have already been successfully using social media, but we still have the working press. We still have traditional media, broadcasting, television, newspapers, radio. And the four panelists today represent those particular areas, and I'm delighted that they've joined us for this discussion. There's Sierra Lopez, who's a reporter for San Mateo Daily Journal, James Henderson, who's the general manager for KHMB Radio, Alexis Terrazas, who's the editor-in-chief of Tecolote, and Diana W.P. Ding, who's the founder of Ding Ding TV. I'll let them introduce themselves, and as they end their brief introduction, I would like for them to respond to the question, what do they think is the most important thing that people should keep in mind when contacting them in an effort to get information to the public through their media organization? Sierra, let's start with you.
Yeah, hi, thank you for having me. So like Henrietta said, my name is Sierra Lopez. I'm a reporter with the San Mateo Daily Journal. We are reaching our 21-year anniversary, covering the northern part of San Mateo County, starting at San Francisco, all the way south to about Redwood City, sometimes maybe a little more south. And I think something to really keep in mind, particularly for a small paper like ours, is that, you know, we're a small team and we try to get to as much as we can and cover as much as we can. But San Mateo County has a lot of cities and a lot of towns that we try to give some fair share to. So, you know, we always recommend if we don't respond right away, try us again. Yeah, don't give up on your pitch. We're always interested in hearing what you got to do and what you're interested in pitching.
James, you're on mute.
Oh boy. Okay. Mr. Techno here at the radio station. Anyway, James Henderson, KHMB Radio. We are a community radio station serving the San Mateo County coastside from Montera through Half Moon Bay. We are a FCC licensed low power station. They licensed literally thousands of such stations across America because they wanted communities, underserved communities to be served. And certainly when you think of our area, the major broadcasters are not going to talk about what's going on at the city council meeting, for example. So we have two people with us that we work with, senior co-siders and co-side Adult Day Health Center. So those are our two people that we interact with over here. One of the questions that you raised was, what is it that we would like from all of the people that see us as a resource to get out their announcements? I would love it if people would give me as much lead time as possible. And I'm sure I speak for other people in the media as well. It is true, radio can be extremely responsive. We don't have the physical limitations of some of our print brethren, where they only publish certain days, certain hours, certain times. That having been said, being a community radio station, and for the most part, volunteers, yours truly does most of the work. It's just a fact. So I wear many, many hats. So my life becomes a lot more easier if people would give me the information they want disseminated as soon as they possibly can. So that would be my big request when all is said and done.
Okay, we can expound upon that more. Alexis?
Thank you for having me. My name is Alexis Terrazas. I'm the editor-in-chief of El Tecolote newspaper. We are a bilingual Latino community newspaper serving the San Francisco Bay Area since 1970. So last year we celebrated our 50th anniversary. I'm really proud of all of the editors and founders that came before me to have this opportunity. And to answer the question, I think it really kind of boils down to what kind of impact you want it to have. And I think that requires recognizing one's blind spots, especially like, say, if you're trying to get information out to a certain community, trying to understand what makes that community tick and the different nuances. Some communities might not be as technologically like savvy as others. So simply providing like a URL, is not enough. Some communities digest information more visually, so I would always kind of urge, it all depends like what community you want to serve and what kind of impact you want to have to best direct the content and information you want to get out to local media and the communities we serve.
Diana? You're muted, Diana.
I was talking. Okay, yes. Thank you for having me. Hi, everybody. I'm Diana Ding. I'm the founder and CEO of Ding Ding TV. And I started my media career in 2002. Before that, I was working in a high-tech company. We do semiconductor system on chip, SoC system on chips. And 2002, and I became a radio host in Xingtao radio station. I have my daily show called Life in Bay Area. And in 2006, I started my TV career, and I had a nightly talk show on KCNS TV. And in 2009, I started my own company, Ding Ding TV, and we started an innovation dialogue, a talk show from 2010. And the reason I started this is I see so many people coming to Silicon Valley, and they want to learn about innovation, and especially the people from Asian country. So we started this online program, digital media. And for all these years, we have created nearly 10,000 videos on YouTube and distribute through our social media channels. And we got like 100,000 followers on social media. And right now I'm quite active on Clubhouse, the new tool that, I'm quite active on that. So I feel like, this technology, no matter high tech or low tech, nothing can replace human touch. So we more focus on the human touch in the technologies. And also for the news, for the contents, and we prefer that, if there's a video, it's always good, because we mainly we're creating videos, because I feel like, video is very important, even though the quality is not so good, even though it's very short, but people love to watch videos. Maybe 10, even 30 seconds video is good. So we always focus on creating videos. And I also hope that you can always give me a cover picture, because whenever you post on website, there should be a cover picture. And sometimes when we don't have pictures, we have to buy pictures, because before we didn't know that. And we even got a complaint about the copyrights. So I prefer that you got a picture and short description for this. And also we have a studio in Santa Clara. It's good for small events, less than 100 people. So we organize all kinds of events. In 2019, we had 82 events at our place. So we worked with different groups, especially nonprofit organizations, and they came to us, and we not only promote their events, we also co-organize the events and also live stream on the internet. So that's how we do. I'm Diana Ding, I'm done speaking. Thank you.
Let's talk about the basics in terms of exactly what people should say when they contact you. Should they contact you by email?
Yes.
There was a time people would send out a press release. What should they send to you when they do contact you? What are you looking for specifically?
Okay.
So let's go back to Sierra, since you just talked, Diana.
Oh yeah, thank you, thank you.
Yeah, I mean, I think that you could take it back to the, the very basics of grade school, the who, what, when, where, whys are always really helpful. So, who is it about? When is it happening? Why is it important? Where should people be looking? Those are really key. And I mean, I think the pandemic has shown, email. We're always on our computers now. Anywhere we go, we're working remotely with our laptops or our phones connected to us. So yeah, I'd say, very basics. Go through your W's.
Okay, Alexis?
I echo what Sierra just said as well. Just kind of really simple like that. But I would also add the caveat of, I know I think I'm in a similar boat with Jim in that I'm juggling a lot of different hats, working from home. My kids aren't here right now, so I'm also have to do the split brain thing. But I think also just because emails can get lost, so I don't see any problem with like contacting us via social media as well. We've had a lot of DMs via Instagram, Twitter and Facebook alerting us about, hey, there's a pop-up clinic happening here. There's an event raising money for, testing here. So all of that is really helpful as well. Is kind of like identifying the social media platforms and contacting said press through there.
So Alexis just now said, before I get on to Diana and Jim, about how things can get lost in email and how you can also follow up. So I'm going to ask you, there was a time people used to follow up with a telephone call. Do you still respond to telephone calls, Diana and Jim?
Yeah, phone call, I only receive phone calls from the people I know. I don't pick up the strangers' phone call. So social media is easier for me. And well, but if you can send them a text message, I will always read that. Thank you.
Jim?
Yes, I would say that basically for the most part, I get most of my information from the nonprofits that have announcements via email. I would say that depending on the urgency of the matter, it doesn't hurt to do both. Send me an email and leave a message on our main line if somebody doesn't pick up. We had an email come in just this morning from Coastside Hope, and they were alerting us to the fact that there will be some COVID vaccination opportunities here on the coast side on Friday, and they asked us if we would get that message out, and of course we will. So I was very glad to see that they alerted me. So it's on Friday, and we'll start publicizing this probably tomorrow, so that people, as many people as possible, as far as our listenership, are aware of it. So again, yes, most of the correspondence I get is via email, but the squeaky wheel. I mean, if it's something really important and you really want to make sure, why not, do an email and follow up with a telephone call.
I think everyone on the Zoom call has been notified that they can put their questions in the chat. So if you have specific questions for the panelists, please feel free to put them in there and put them in quickly. In the meantime, we talked about the basics. What more do you think people should know? Has COVID changed anything? We've spent, 16 months perhaps in lockdown, and we've heard today that we can take our mask off with conditions. So what has COVID changed, if anything, and what might you expect with the loosening of restrictions? Sierra?
Yeah. I think what COVID has really changed, which has been, I think, particularly difficult for news dissemination, especially when it comes to the visual element, is access. We've all been really scared to gather with each other and to follow those precautions. And so a lot of times reporters have been shut out of, areas that would really help tell the story. So as we start seeing things open up again, it's gonna be really exciting for nonprofits to begin inviting us to their events. And if you are hosting a clinic, if you can give us that access to get there and to talk with people and hear those real in-person stories, that's going to be such a change from what we've been seeing over the past year.
What's the time range you talk about giving access in terms of notification? How quickly in advance should you be notified?
I think because I do want to be careful when we talk about the email, losing things in email. If you send us something too early, then we might lose it. I think the sweet spot for us is maybe a week or two. But if you do find out something's occurring and it's a day out, it's a couple days out, there's no loss in shooting your shot and letting us know that something's happening. We can try to get a reporter out there. But yeah, that sweet spot's going to be probably about a week.
Okay, Diana, Jim, Alexis, please don't wait for me to call on you individually if you'd like to respond.
Well, I'll just say very quickly, is there such a thing? Anyway, I will say, try to say quickly that for us, COVID-19 probably has resulted in more phone contact where people would come into the studio to record interviews and messages. Now we do that via telephone, and the quality is okay, but the best audio for radio is obviously where you're in a controlled environment like a studio. So that's been the biggest thing for us, is the fact that people haven't been coming through the door, obviously, and we've made most of our contact for interviews and that sort of thing via telephone. Diana?
Yes, during the pandemic, since people are not able to come to the studio for the event, so we started online event. We had our civic leadership forum 4 times a year. We still continue that, but we moved everything online. And I think that people get used to online even after the pandemic. I think that many of them will not be able to come, or they don't want to go to the on-site. So I think that online is a thing that is going to be continue even for the press release, a press conference. Many people hold their press conference online because for the small media like us and grassroots entrepreneur in Silicon Valley, we're not able to send in report to the events actually. So we can do something online, and also when we receive the contents, and we can also promote through our social media. And yeah, I prefer the email. The email is good that you can, or you can contact me through my, Instagram. Instagram is the thing that I check from time to time. You won't miss me there. Thank you.
Sure. Alexis.
Yeah, I would say it's definitely been a double-edged sword in a sense, and Diana was talking about this. The fact that we have so many more opportunities to cover press conferences virtually. It allows our reporters, and all of us are working remotely right now. We're all working from home, so it allows us the liberty to not have to rush out to a location and cover that, right? So that's been a positive, but back to what Sierra was talking about initially, the physical access to get imagery, and the fact is, we have to remember, not everybody can sit with the story or have a story resonate with them. There are different ways, and maybe the information resonates with somebody different when it's a photo story. It's really hard to get a photo story, especially during the early months of the pandemic. We had our photographers that we did not feel comfortable sending them out into the field, covering, testing locations, testing these photographing these different food pantry distributions and whatnot. Thankfully, there was a lot of mobilization in our neighborhood where we were able to get access to vaccination. So a lot of our photographers were vaccinated early on. So as we move towards maybe these reopenings, getting visuals has been easier. But it has been kind of this, especially at the beginning of the pandemic, it was definitely this double-edged sword where, yeah, you could attend a press conference from the comfort of your home. However, you can't shoot a video, you can't photograph from the comfort of your own home. You have to be out in the field. And if and this is something that I kind of hold as a guiding light, produce content that's going to have the maximum kind of impact on your community to motivate them to either protect themselves or give them the maximum kind of information, a lot of times you have to be really creative in curating that information or curating that content. At times for us, people have told us that, we have newspaper online fatigue. We'd rather watch a video, as Diana was saying, or maybe it's more striking looking at a photo story or a podcast, something like that.
So when you talk about curating fatigue, what are you talking about? I'm sorry, curating the message, what do you mean?
Yeah, so we had an example. I'll just kind of use an example. We were covering one of our local testing sites and vaccination centers here in the Mission District. And it occurred to us, even though we were producing content in Spanish for our Spanish language community, that a lot of our Spanish language listener or readers weren't all that proficient in reading in Spanish, especially when it comes to scientific kind of data, like going on to like my turn, figuring out when to get your vaccination, all of those things. And they told us that for them, the best way to kind of get this information and to digest it was visual, either like maybe like a flyer that shows step-by-step what to do, or a video. So we switched gears. We changed our way of like getting this information out to specific communities. And that's what I mean by adjusting. We've had, and at that point, we had about a year of reading nothing but COVID content. And I think that creates a lot of fatigue. All of us were covering this stuff. And of course that creates fatigue, even though I feel really strongly that it was important. So I don't regret doing that. But it's again about listening to your community and seeing how to best change directions in terms of like altering how you get your information out there to have that kind of impact that you want.
So in the few minutes that we have left, would each of you share what's important, perhaps, that we haven't discussed that you would like to share in letting people contact you, in giving people the opportunity to use your media organization to outreach to their communities? So Sierra, I like to start with you.
Yeah, I think it's really important to remember that we are in the information dissemination business, but we're also in the storytelling business. And so it's really important for us to be telling compelling stories. So if you can reach out to us with anything compelling that's going on, whether that's your organization needing to fundraise to survive the pandemic, or your food drive efforts, whatever those are, if you can make it compelling, that's amazing for us. And again, the access aspect, if you can give us access to real people, I think we've all been inundated with figures and numbers, and just the count has been a lot, but it's been hard to get some of those real person stories. So those are probably the key things for us.
When we think of the word compelling, we might think of different things. So what do you mean by compelling?
Yeah, so we like to think of them as human interest stories. So things that are going to make you feel something, whether that, again, the idea of any organization struggling to make it through the pandemic, that's a compelling thing, especially if you've been in the community for a long time. As much as we love to hear about, your executive director changes, and some of a rebranding, that's great information to give to us. We love that. But we also want to hear, some of, the bigger efforts that you're pushing forward. Thank you, Diana.
Thank you, Henrietta. Yes, I think that, I agree that storytelling is very important, but we prefer the focus on people because people interest is really important. So focus on people, and we really like the story associated with the new immigrants, ethnic groups in the Bay Area. The sufferings and also the important issues and the values and the histories and the stories about the ethnic groups. That's something we always interested in. And also we would like to work with all the other medias, and in some way we can always work together, and do not ignore the new tools and new apps like Clubhouse. It's for now is probably the most easy and impactful tool we can use for now. So I'm open and and also I think that a resonate with value, a common value is very important to us, because it's all about, we build our community with common value. So resonate with the value is also very important. It's not the luxury, it's not the, what happened to those rich people, but it's, for the immigrants, for the ethnic groups and our sufferings and our true story. That's something we're always looking for. Thank you.
Jim?
Well, I certainly concur with what has already been said on that particular subject, but I would add to the compelling part this observation. Here on the San Mateo County coast side, there are 58 to 59 nonprofits. So you're in competition with other nonprofits for the ability to get your message out. And so, yes, the message does need to be somewhat compelling rather than announcing that you're going to have bingo on Thursday night or something like that, which maybe is only going to be a very limited potential audience that would even care about that. So yes, I would certainly concur that there's a compelling aspect to it, and that you should consider the fact that you are in competition. There's only so much space in the paper. There's only so much time on the radio that's allotted to public service announcements and that sort of thing. So make it a job, make it important, raise it in elevation to what you're trying to get to us. And of course, always in a timely manner.
Sure, Alexis.
Yeah, I concur with everything everybody just said. Human interest stories, of course, they're compelling, but I would also kind of put forward a challenge too, because a lot of the community organizations that you represent, you're already in contact with said community, right? You all represent certain people. And I feel like a lot of times we tend to gloss over the communities that we're connected to and refer to like other experts to really get what's going on the ground. A lot of times it's just about asking the people that you serve, what is it that is happening within your own community and what can be done to change that. And the other challenge too, that I urge everybody on this call, including myself and the other journalists, is, a lot of the times we have like these narratives, like these preconceived narratives of what the big story is. And I think always kind of keeping a healthy check on that and challenging and pushing back on that is a really good thing. And an example of that, early on, we kept, at least for myself, I'll speak for myself, I kept seeing stories, particularly in Black and Brown communities, of how we were really, this issue about vaccine hesitancy, and the various different things in the past that have happened to cause that hesitancy, right? So what I saw the narrative happening, or how I perceived the narrative, was that here are these groups of people, these communities of people that are maybe being irresponsible and not believing in the science. But I feel like it's good to challenge that, and we wrote a story not too long ago that looked at, okay, yeah, we can acknowledge the hesitancy that exists, but how about we look at the barriers that exist for certain communities to have access to these vaccinations. We spoke to a doctor in the East Bay, Rhea Boyd, who made the point of, if everybody overnight in these communities was to say, you know what, I don't have any vaccine hesitancy, I'm going to get this vaccine, would that have changed how, like, the percentage of people in these communities to get the vaccine? And probably not, because there are so many barriers that exist to getting the vaccine or getting tested. So that's one of the things I would put forward, in addition to what my colleagues just mentioned. Always trying to keep a healthy challenge of challenging your own preconceived narrative of what the story is. And one of the ways to do that is by speaking, in direct contact. And maybe you're already doing this, and if you are, I applaud you, but really speaking to the communities that your organizations serve.
Well, thank you so much. I'd like to thank the four of you. We have a challenge in terms of time, and dealing with that challenge, I'd like to turn things back over to Petra.
Thank you. I want to say a huge thank you to Alexis, Sierra, Diana, James, and of course a special one to Henrietta for helping to organize and facilitate. This was great, and I want to invite you all, if you'd like to stay, we're going to be doing question and answers with the health department, so there might be something that if you have questions, you're welcome to do that. And then for the rest of you, we will actually debrief a little bit on this and talk about how we've been using media and what we think could be more effective, because I think we got some really good things to think about. So really appreciate you guys being here, and you're welcome to stay or go, but thank you very much.
Thank you.
Thank you.
It was a pleasure.
Great. Helen, would you like to introduce Dr. Chan?
Sure, thanks, Petra. And thank you so much again to all of our panelists. Thank you for being here and for your insights. For our next portion of the meeting, I'm excited to introduce Dr. Curtis Chan, our beloved Deputy Health Officer for San Mateo County, who has graciously offered to attend today to help answer any health-related questions. Dr. Chan, did you want to say a few words?
Yeah, I just want to appreciate, oh, I can see myself large on my own screen. I just want to appreciate the reporters who've been really instrumental throughout the pandemic in getting the stories out of how to prevent infections, how to seek testing and vaccinations, and really to hold government and healthcare accountable. Those are all important elements for serving our community. So I really want to appreciate that. So some of the things that I think that I heard was that for this upcoming stage of the pandemic, particularly because many of the older adults who are most at risk of having complications have been vaccinated, the risks and benefits of getting the vaccine, intersecting with activities moving up, moving open, the availability of the different vaccines, so the Johnson & Johnson vaccine and the Moderna Pfizer mRNA vaccines. Those become a really complex issue that it's difficult for myself or a single press release from federal, state, county government to be able to describe in a couple of sound bites. I think it just requires all of you that you've been participating in these events, and you've built so much capacity and knowledge and expertise of the topics, the science, and what the community needs are, that you're the persons who are able to, I think as our colleagues, our reporters said, I think it is most appropriate and effective is to ask community members such as you and your communities that you represent, the person stories connected to the overall public health guidance that you can convey is incredibly important and impactful. And tying this up into an overall narrative is really important too. So I think I'll leave it at that. I think some of you are going to hear me on the elected officials call tomorrow and the the Vaccine Communications and Equity Working Group on Thursday. So I'd rather really just listen to you all and answer any quick questions and talk about the insights of the 5 reporters that we had earlier today. So that's it. Any questions?
I have a quick question, if I can. President Biden said we could take our mask off with limited conditions. So I'm wondering what will be the message of the county? And does what the president did today complicate some of the county's efforts in keeping everybody safe?
Yeah, well, Henrietta, I realize I'm speaking to a room of reporters here, and I just wrote no comment to the Chronicle. So, so the official word is no comment for right now. And just the overall context of things is that we're following CDPH guidance, and for you all as community leaders, I think it's a balance of providing accurate scientific information, which the CDC is doing, we really want to convey the benefits of the vaccines, which are, and just to be clear, I saw from the chat too, it's for fully vaccinated people do not need to wear a mask outdoors in certain situations. So I think that's sound guidance. I think in general, and maybe it's something I want to discuss with the Vaccine Equity Working Group. I have two particular concerns about this. One is, one is that there's still many people who are unvaccinated, and particularly the people who are unvaccinated are in Black and Brown and also poorer communities. So I'm still concerned about that people are going to be approaching, let's say, concessionaires at parks and outdoor spaces without masks on. I think that's an overall concern that I have. And also approaching, like park staff. I'm concerned about the impact on workers who are working outside, that they may be approaching workers without their mask. And CDPH had good guidance since November about that, you should always bring a mask with you, but you don't need to wear it when you're within 6 feet of others. Now, I think I would reinforce that overall statement that CDPH has. So, it doesn't make sense. I think I've said this before, maybe on your show, Henrietta, because it doesn't make sense for, let's say, like a person who's a landscaper, right? A landscaper, when it's getting hot these days, and let's say North Fair Oaks or South County, doesn't need to be wearing a mask, if they're just performing their activities outside, so that's I'm saying this in kind of a clumsy way, but like, I think of what I want you all to know as community leaders is to really distill this information, discuss it with each other and think it through. So that's the first piece. And the second piece I'll really say really quickly is that I think for communities that have been most impacted by infections, transmissions, and deaths, what the central problem is that those communities, some individuals still have not been vaccinated yet by the healthcare provider or any of the vaccinators, and people don't know who's been vaccinated or not. So you could have you could have a whole groups of people claiming they've been vaccinated and then approaching people who are basically workers without their mask. So I think that's going to cause considerable mental health risks and stress. So I just want to say those are the things I'm wrestling with. On the other hand, it doesn't make sense to be insisting that everybody who's fully vaccinated is wearing masks. There shouldn't be a law about that. So I think it's probably something that we would love to be partners with community-based organizations and think about not what health officer laws need to be, but really what community standards and community good manners and respect looks like. So I'll just leave it at that. That was a long no comment. But.
Thank you.
Dr. Chan, I had a question if this is appropriate time.
Sure.
Okay. Given, I heard that announcement as well, and we have our farmers market tomorrow in Pacifica, and we're probably going to have about 700 people coming through there, and on Saturday we'll have over 1,000. And we were concerned already, now that the vaccines had started, that we were going to get a more pushback because our policy is basically we're sticking with what the CDC says. And if the CDC is saying you need to wear your mask outside, you need to wear your mask outside in order to come into our business. And I don't know if anyone on this call has come up with any other key phrases that might be helpful in getting the point across. Some people are probably going to just be, some people are very important, and what their opinion is all that matters, and it doesn't matter about the people that are around them and how they're affecting other people. And I guess, our stance is going to be still, this is a private business. we have the right to refuse service. And you have to wear a mask in order to attend the market. But any feedback or any help on that? Appreciate it.
I think you initially asked me, but I think you want to get comments from your colleagues, which I'm interested in learning too. But I totally agree with you. One, I think from the CDC's perspective, I would consider that to be a crowded venue, so masks should be required. But it is going to complicate things. I would still think it's not. I think the risk of transmission actually of COVID is actually quite low and small, but I think it's more that it's gonna cause a lot of mental health distress for the people attending the pandemic. And if it's gonna be in Pacifica by Rockaway Beach, it shouldn't be hot enough to not wear a mask, too. So I think it's a good idea, and we could help with some county messaging as well too. And you can connect with OCA, and we can take a look at it as well too. But I'll stop there because I definitely want to hear other people's ideas.
Well, Aaron will be on the meeting on Thursday as well, but tomorrow's Wednesday.
We can talk about this more in the breakout rooms as well when we get there. Dr. Chen, do you have any quick update on vaccine availability? Because that seems to be changing daily, and I know you're going to update on Thursday, but anything you want to tell us about how much vaccine there is?
No, I mean, it's because I don't know. I mean, I've looked at it, but I can't really say anything like that's really helpful. So I don't know enough to say. I'll say something on Thursday though.
Okay.
Once I actually look at it more clearly.
Great. Well, we're hoping we're getting to a point where we're getting closer and closer to where there's more. So
yeah, I think that's like just a broad thing that like Contra Costa, Marin, and other counties preceded us in having people reach saturation of what vaccine demand is. And there's definitely going to be increased supply for the next several weeks. And we will reach a point where we're quickly reaching that point where there's vaccine hesitancy versus vaccine supply is the issue. And again, just really appreciate the reporters who were on here earlier and describing the benefit. I mean, the benefits of the vaccine and having human interest stories are just so much more effective than what Dr. Morrow and I can say on a news story. So really appreciate you all.
So I think that's kind of key to this group, where we've been evolving. Like first it was about what is COVID and how do you protect yourself, and then a little bit more about how to get the vaccine. And then our next kind of phase for this communication is going to be, how do we get over the vaccine hesitancy? We're almost there. I think we have to there's still people who are waiting, who aren't hesitant, but I think that's kind of our next big big hurdle to jump over. Like, how do we, what is our communication? What is our message going to be?
Yeah, I think it's really going to need to be nuancy as well too, because I think I've said previously, I mean, I think it's valid. It's definitely valid and appropriate to have concerns if you're a young woman. I think the benefit far exceeds the risks, but I think it's important for all of us as community leaders to really be able to say, okay, well, Moderna and Pfizer is coming, and that appears to be safer currently, and we should just try to be as transparent and authentic and as possible. So, and those things are not, I think you all as trusted messengers are going to be the ones who are going to be able to increase that vaccine uptake for, I think, and I think it would be okay if like not all young women like 18 to 29 went out and got the vaccine right now. I think it's okay. I think it's not a good idea, but it's just, you can just see the lack of clarity in my own mind. I mean, you've seen me say things very clearly before, like mist, you need a mask, isolate, and self-quarantine right away, and testing. And then there's so many times I'm like, not trying to oversimplify things, because I want you all to know that it's not a simple message as like just say no to drugs. It's like, and again, it's just you all asking good questions of each other, and sharing best practices is the way to go, I think.
We're going to, if nobody has any more questions for Dr. Chan, then we're going to divide into our 3 breakout rooms. If Kirsten, you're ready to send everybody off to the breakout room. So in the breakout rooms, we're going to talk about kind of how we're going to outreach to media, and as well as what kinds of, what you're hearing from your community now. We would love to hear specifically about vaccine hesitancy, if you're starting to hear about that, or vaccine access, whatever it is that you're hearing on the ground would be great. So Kirsten will divide us up.